that I've had in an office, I believe that the dentists don't tell you everything. So these are the things that I believe that the dentists don't tell you. First thing is that it is possible to dye with your teeth healthy and clean. To accomplish that, you must floss your teeth at least once a day, recommended right before bed, right before you brush, and there is a proper way to floss, which I can show you that later. Also, brushing your teeth at least 2 minutes each time, 2 times a day, and all surfaces of your teeth. Make sure you get everything closest to your gums, everything. Your gums should not bleed, and that's one thing I noticed a lot of people had a problem with, and they get afraid to floss because of that. The thing is you have to floss in order for that to stop, and that's one thing that I noticed dentists don't tell people unless you ask. Another thing you must do is regular cleanings every 3 or 6 months. Usually it's 3 months, and the dentist will let you know, or the hygienist will let you know when you're in the office getting your cleaning or your regular checkup. When you do get that checkup, you're also going to get what they call is measurements of your gums, and make sure that they do that, because I've been to offices where they didn't, and I didn't even know they were supposed to. On top of all that, eat a lot of less sugar. If you eat too much sugar, obviously the acid in your saliva will damage your teeth. If you do have to have sugar, one thing that you can make possible to not have a lot of cavities is to rinse your mouth with water afterwards, kind of like mouthwash. Then again, you never want to ignore any kind of pain. If the pain lasts long, like a duration of time when you first feel it, that usually means that you need a root canal. And not to scare you, but it could be that way. But a lot of people have sensitive teeth, so if it's a small little hinge or if it's something really short, then you should be fine. There are toothpastes that you can use to help with that. And it really doesn't matter what kind you use, you just use whatever you preference. They do recommend a lot of times that you do use the Sonicare so you don't brush too hard. That's one thing I noticed also is people just brush way too hard and they brush their gums away. That also causes a lot of sensitivity that people don't realize they have until they get into the office. Let's see, and one big thing that I noticed was the amalgam, which is the silver filling, versus the composite, which is the tooth-colored filling. There's a lot of controversy about which one's better, and from the experience that I've had and a lot of the background that I've learned through the offices that I've been to is that dentists don't really inform you enough on that stuff. And from what I've learned and what lasts is that composite is the way to go. It doesn't last as long, you have to change it more often, but it definitely seals that tooth a lot more. And also, when the dentists use silver and they use the silver filling, they take away more tooth than they have to make it fit. So that was one thing that upset me. And at the same time, my old dentist used to say that silver fillings grow up to be crowns. And it's true. A crown, if you don't know, is a fake tooth that is glued on top of your original tooth after it's shaved down into like a stump. And a lot of people don't realize that if they choose the silver, down the road, could be 2 years, could be 10 years, depending on how well you take care of your teeth, you're going to have a crown, whether you like it or not. Silver cracks your teeth, it turns in color, it's just a bad thing. So, even though it costs more, even though insurance doesn't really cover it, your best bet is to do composite. No doubt about it. Let's see. When you find a dentist, you want to find one that's patient with you, one that if you express any kind of feelings that they show some concern with that, because I've seen dentists who don't really care, and then what they do is they rush through things. All they're doing is doing it for the money, and it's just not the way to go. You want to find a dentist that any kind of concern that you have, they address it no matter what, and they don't tell you, hold on, I'm almost done, because that's just not okay, especially when you have children. There's another thing that I noticed with dental offices is that they charge a lot for what they do, but then again, when you're paying a lot, it usually means the dentist has a lot of dental background, which is okay. Just research before you choose one. Get an idea and a feel for the office before you actually keep going, and look for a place that has a hygienist, because a lot of dentists do their own cleanings and they don't do them right either. So you got to be really careful on who you choose. And I'm going to make another video coming up soon about some more. Okay? Thank you, and thanks for viewing. Bye.